Hepatitis C virus is a blood-borne virus that causes liver damage, and if untreated, can be life-threatening. It is most commonly spread through injection drug use, unsafe healthcare, and other exposures to blood. While around 30% of people clear the virus and recover without treatment, the remaining 70% develop chronic hepatitis C, which affects approximately 71 million people across the globe. Unfortunately, there is currently no vaccine for hepatitis C. Due to the recent availability of highly effective, direct-acting antiviral treatment, proven to cure greater than 95% of patients with hepatitis C virus, there is an unprecedented opportunity to reduce disease burden and mortality. The World Health Organization has set a goal to eliminate hepatitis C as a public health threat by 2030. In order to meet this goal, we must diagnose 90% of people with hepatitis C and treat 80% of treatment-eligible patients by 2030. The price of direct-acting antivirals has reduced from over $80,000 to less than $50 per course in some contexts. So now for many countries, the diagnostics might be more expensive than the treatment. For countries to make the best use of their resources, they need to be able to identify the most cost-effective testing strategy. A tailored diagnostic strategy is needed to suit each situation rather than a one-size-fits-all approach. This is because hepatitis C prevalence can vary substantially by country, and differences in population characteristics and resources create different opportunities for testing and engaging affected people in care. So what's our role, and how can the Hep C testing calculator help? As part of Head Start, a project supported by Unitaid, and with guidance from the WHO, FIND collaborated with Harvard Medical School to develop an interactive online tool that evaluates various testing pathways and identifies the most cost-effective strategy for a specific country. This is achieved by linking hepatitis C testing approaches to the disease progression of hepatitis C infection and treatment. How does the Hep C testing calculator work? Users can select the country, which changes the underlying disease burden model and default parameters. Users can then change the cohort size, disease burden, target screening rate, and direct-acting antivirals cost, making this highly customizable for specific settings. Users can then create their own testing pathways that include various test types with customizable costs and follow-up rates. Default options can also be used. Results for each pathway are generated, including number of cases diagnosed, cost per patient diagnosis, cases of decompensation, how many liver-related deaths could be averted for each pathway. We are now in the process of expanding access to our tool to help more countries manage testing successfully, with the aim to eliminate the threat of hepatitis C worldwide. For more information about the calculator, please write to the email address shown on screen.